One of the most common side effects of cannabis is lowering of other medications. The number of people who come into the office, whether it's reducing their pain medications, their Oxycontins, their other morphine derivatives, as well as on the mental health side.
Dr. David Berger has been practicing medicine for more than 20 years. In 2016, he opened his own Florida clinic to help medical marijuana patients across the state. He says he has seen firsthand the benefits of using marijuana to treat patients, and there is some evidence behind that. A recent study of 100 patients at a pain management clinic showed a nearly 70% reduction in opioid usage on a follow-up visit after those patients were prescribed medical marijuana. Despite those findings, some pain management specialists say the science has not been proven, and there's more research that needs to be done.
Medical marijuana has been legalized, decriminalized, and broadly available, but we've done that ahead of the science. So there's more that we don't know about the use of medical marijuana than we know.
But specialists say there are other drugs that have undergone rigorous testing and been approved by the FDA, unlike marijuana, especially for weaning people off opioids.
So weaning mechanisms for opioids are things like buprenorphine, naloxone, or methadone, and those are evidence-based and substantiated. So taking marijuana to get off of opioids isn't necessarily going to work because they're working on different receptors.
It's also the nature of how marijuana is sold. She says doctors who write prescriptions often don't know what their patients are getting.
Marijuana, the way that people receive it, it varies. It varies by state, it varies by dispensary. The ratio of THC and CBD is going to vary by every single strain.
And it has been difficult to study the science behind medical marijuana because it is still a Schedule I drug, which the DEA describes as having no accepted medical use, unlike many opioids.
And we have been arguing at a national level from the professional associations that it needs to be rescheduled as a Schedule II so that researchers can conduct trials on it without the barriers that are currently in place. And the problem is that we don't have good data on the potential harms and the potential benefits of medical marijuana.
A bill to move marijuana from the Schedule I to Schedule III of the Controlled Substance Act was introduced last year. Holly Gregory, Spectrum News.